Absolutely. Thank you so much for giving me a couple of opportunities just to share about what I do and just some of the work that we've been gaining some major capacity around in Austin. And so I'm going to go ahead and share my screen if that's okay. It looks like we have, there we go. Okay, here. So I'm going to go ahead and give you guys access to that there. Perfect. Is everyone good to go? Can you see that, Lotus? Fantastic. Awesome. So let me just start off by saying the truth behind data and research racism is so complex, right? It's perverse, it's opportunistic, it has the potential to perpetuate racism, where people of color are no more than petri dishes researched, right? They're analyzed, justified by these theological frameworks that we introduce to them that they end up being completely unaware of, that explain their experiences away without us even asking them. And so what my organization does at Measure, we are a team of Black and Brown women data activists. We do have some in there too, that are doctors and lawyers and scientists and mamas and college students, and people that have just got out from being locked up, right? That have lived experience, that respect data, to include lived experience data. And then we use that to mobilize our community in order to take research to action to create our own solves, right? And so there are so many ways in which the biopic community has been betrayed by traditional academia, data collection and research, that I'm sure that we're going to discuss today on this conversation. So to disrupt traditional research methodologies, Measure has really developed the CARE model, which is a new system that's literally changing the game. And so just like Lourdes mentioned, our organization, our target problem is that lived experience and quantitative data about complex social problems impacting people of color is not used effectively for change, due mainly to historical, to structural racism, due to a lack of accessibility, right, of great data tools, and what I think is mostly important, the lack of village support. And so while Measure has several programs, our main solve is our ability to provide free data support to Black and Brown-led organizations. And I love the way Lourdes said it. It's just the absolute truth. We do this, we're able to provide this free service to Black and Brown-led organizations by charging white-led organizations the full rate of our services, and also organizations that have the economic means to support it. And so this anti-racist revenue model has really caught wind within Austin, and quite frankly beyond. So what you're seeing right here is what we do. And so at Measure, our evaluation tools have gone through a very extensive community-led process to ensure that we're really authentically representing the people in our work. So we routinely evaluate ourselves and our tools and processes to make sure that the work is truly anti-racist. So what you see is our 4 different evaluation tools that we use with our clients, and what they receive when they register for our support as well. What I've learned is that without an equitable framework built into public administration models and tools, health systems, we really risk that continual cycle of racism within our largest institutions and social services within America, right? We realized this early on at Measure as a grassroots organization. I'm a activist to the bone. But what I decided to do in my capacity was think through, like, how can we use data and measure in order to really impact change? And so during that time, we really began to think very deeply about the development of some of these tools. One thing led to another, and really essentially the one that I want to talk to you guys mostly about today is the CARE model. So I will advance that slide. Hopefully you can see that well. And so the CARE model it stands for Community, Advocacy, Resilience, and Evidence. And it's a process for working really in active partnership with communities to develop solutions to complex social problems. So as you see, again, each component of, really represents a piece of the community mobilization process that organizations and institutions go through as they partner with communities to address these specific problems. And it could be within health, it could be within criminalization, it could be within, voting rights, just whatever issue that community is looking to change. It really provides a means for increasing meaningful engagement and minimizing trauma or potential harm to the community. So, the CARE model is based on 4 guiding principles, and you'll see that right here to the right of your screen. Number 1, community is really involved from the beginning. You are going to advocate with the community to address disparities. That's that power switch, right? You're going to generate solutions that strengthen community resilience. And then E is to use data and evidence for data-informed decisions. Each time we use the CARE model, we dedicate 3 months to its completion. So we are literally in partnership with these organizations that we're invited into. We begin with phase 1, which is that down there at the bottom, which is the community engagement phase. That's when we begin to just understand and align on the problem, empathize with the target community, strengthen sociocultural cohesiveness, really understand what happened in that community to perpetuate injustice around that issue. In phase 2, we go, again, even deeper. It's really drilling down on the solutions. And then in phase 3, it's all about, implementing those plans, and then evaluation comes into play. When I say evaluation, our team really works with our groups, we call them CARE teams, to identify just a few community impact metrics, outcomes, outputs, so that they're able to track their progress and eventually prove their theory of change, or assess, rather, their theory of change. Oh, this is my favorite slide. Okay. And so the results of using the CARE model have been incredible. In fact, pretty phenomenal, especially right here in Central Texas. Using this framework, we've really been able to do lots of things. So number 1 is that we've launched the Innocence Initiative, which has provided us the opportunity to intentionally protect Black girls. Intentionally protect Black girls. I like to say that. In Central Texas, we have this award-winning program now where we've been able to train 700 attorneys on how to intentionally protect Black girls from adultification bias. The community came together and they've distributed over 15,500 community-created comic books about Black girl magic, and those have been distributed. A community-created policy brief that's informing new laws in Texas and more. A mentorship program for Black girls have been launched that provides monthly cash stipends to our participants, and also provides them access to 2 Black women psychologists that are also on our team. Black women mentors, food. I mean, it goes on and on and on in the ways that we've been able to protect Black girls. What's also been an incredible result from the use of the CARE model is, and it's something that we really did not expect. And I think those are some of the best outcomes. It's the ones that you don't expect, but they happen, is that new people of color-led nonprofits are now kicking off because of the CARE model, which has been really dope to see. And so, when COVID-19 hit, we were able to rapidly, convene our community around the proven model. in order to launch a needs assessment. We collected over 900 responses about people of color and how they were being impacted by COVID-19. This information also helped to really drive resources back to the community. So having something that people can come around very quickly to deploy change is really important. The model has also been deployed, and I hope you guys can still see that increasing equity circle here. Do you see that there? It's really been pretty cool when it comes to making change legislatively, right, and impacting our community in that way. And so, this small town here that you see this picture, it actually created a new law, the first law that created the first equity commission. And yes, that's all due to community power, but it's also due to having a proven method that people can trust and that people can come around. And so that's really what the CARE model has done. I'll go ahead and advance to this slide. And so, what's next? How do we increase our impact? Is what I've been grappling with personally. And so, first of all, we are now working to identify funding to really increase our impact. That's really where we're at. In 2019, we started a college course at a local HBCU on data activism to increase the number of Black and Brown researchers, to create a pipeline of Black and Brown researchers. The class was piloted in the fall of 2020 at Houston Tillotson University. It prioritized equity in research and has taught 16 students to use that model in that class. The program was actually so successful that the second cohort of students has already started this semester. And they're learning the CARE model, and they're learning, all kinds of incredible research tools. And we are really hoping to bring that same class to Texas State University this fall. So that's really where we're, just increasing that pipeline of Black and Brown researchers is incredibly important to the growth of the CARE model. Also, to serve people of color organizations, we need more people that are trained to facilitate the model. So the goal this year is to really recruit 20 new certified measure educators so that we're able to meet the needs of these organizations with our tools. A certified measure educator is just somebody that facilitates this work. And so in total, we provided over 1,000 hours last year. I think it was 1,239 hours last year of free data support to Black and Brown led organizations. And we hope to do that same thing again. So that's really going to help to increase the impact of this community created model. And then finally, the research community, although I am huge on talking about disrupting traditional research and, bringing down the system and rebuilding the system again, I have such an affinity and love for research and for academia. And so, that community plays such an important role in the impact of the CARE model. So we're literally training researchers right now, like at some major institutions, on how to use the CARE model and how to use these activist created tools, right, that are making an incredible impact. So definitely that's a big component in us growing this model. And so I welcome your connection. If you are interested in learning more about Measure, please jot down this information here and connect with us, either email or checking us out on our website, which we are still kind of building out, but definitely would love to connect and partner with other organizations. I think that's the very best way to grow this work. So thank you for that time.